In 2021, community members across states shared stories with the Nigeria Health Watch team about losing women they knew from complications due to childbirth. In Nigeria, according to the Nigeria Demographic and Health Survey, for every 100,000 live births, 512 women die while trying to give life. These deaths are not just numbers, they are mothers, wives, sisters, friends, and their deaths are preventable.
I lost my mom when they were trying to give birth to me. The doctor said it was complications.
Women die from complications following being pregnant, then childbirth. The focus and the leading cause is actually postpartum hemorrhage. Postpartum hemorrhage is the commonest cause of the severe bleeding, and it just simply means bleeding after childbirth. So this happens when a woman after birth, the uterus didn't contract enough to stop bleeding following delivery. It's said to contribute to 1/4 of maternal deaths globally. That's postpartum hemorrhage right now. And Nigeria alone, 22% of our maternal deaths is out of postpartum hemorrhage. And sadly, Nigeria contributes to 19% of the global burden.
Evidence shows that the majority of maternal medicines used to treat the leading cause of maternal mortality, which is postpartum hemorrhage, in circulation in Nigeria are substandard.
She delivered the baby safely, but later on, she started bleeding, and they rushed it before they do everything. He couldn't make it, and she died.
My uncle's wife died during the process of which she tried to born. So as the only man where there was my uncle go up. So I have to carry her to the hospital. Carry her to the hospital. As we reach there, my nurse there. They say doctor no day. They try call doctor. Doctor no ban they go. In that process, she can't like try born by herself. She they push. Don't push the head of the baby don't come out. She don't get her strength again to continue. So after some hours, she can't give up.
The person I lost was in labor already, so she went to the hospital by herself to inform them that she's already in labor. And because she was not feeling much pain, the nurses decided not to even check how many centimeters is it, if she's dilating or anything. They just kept her there and told her to sit, not knowing that she's not one of those people that really make known if she's in pain. So they told her to sit for a while until the placenta ruptured.
From the Why Are Women Dying report, results show that the quality of care and commodities, and not just access, is a key determinant of maternal health outcomes. In the report, one of the recommendations made was for the improvement of quality of care delivered by the health workers. Quality health services cannot be delivered without quality-assured medicines.
My own friend, a keke man like me, now for my very present, a wife, they shout, blood, they come out, nobody to help. Doctors, I beg, she did, the man, they cry for help, nobody to help him. For my own very present, the wife died.
There is a friend of mine, his wife was in labor. So before they should take him to the hospital, she lost so much of blood. They test her and they said that she has short of blood. Before the husband could get to the hospital, the woman, she's very weak and she gave up.
For a woman who was otherwise very healthy, the process of pregnancy and the anticipation of birth, but delivery, the woman dies, For that family, it is no longer a dot in the number of some percentage. It is a whole, it's 100% for that family. For a child that would be born to realize that it was during his birth or her birth that the mother died, the consequence is you can't quantify that.
Poor quality of care impacts health outcomes. More people die as a result of lack of quality of care than access to care. 1.5 million more people die yearly due to poor quality of care than are dying from the lack of access to care. This is why quality matters, because quality healthcare determines the health outcomes of a client. Thus, quality health services cannot be delivered without quality assured medicines. Ensuring medicine quality is critical in providing safe and effective healthcare and reducing maternal deaths. There is a need for the strengthening of regulatory frameworks and governance in the procurement of quality assured maternal health medicines. So, what needs to be done to improve quality of care and commodities for maternal health? It is important that procurement processes and policies for maternal medicines be improved across states. Facilities and pharmaceutical vendors and companies should work with the states to effectively implement standard policies for the procurement of maternal medicines. Ultimately, stakeholders involved in procuring and handling of maternal medicines must prioritize quality when discussing medicines.